Thank you for choosing Mercy Medical Center. Our goal is to provide Douglas County residents access to state-of-the-art healthcare right here at home. We hope that this video presentation will furnish patients, their families, and loved ones with valuable information in regard to what to expect during their time here. At Mercy Medical Center, we're committed to your well-being. Please let us know if you have any questions concerning your care, or if there is anything we can do to make you more comfortable during your stay. We have interpreters available for non-English speaking patients and family members. When you arrive at Mercy, you'll find separate entrances for visitors and patients. If you are a visitor to the hospital, our volunteers can assist you in finding the patient you are here to see. If you are a patient to our hospital, your first stop will be the admitting department. Here, you'll be greeted by staff and guided to a private area for registration. This is where you'll fill out any paperwork associated with your stay at Mercy, including patient information and consent forms. We will also issue you an armband to wear throughout your time here in the hospital. The armband includes a unique patient identification number so we can keep track of you during your stay and so we can access your medical records electronically throughout our facility. From admitting, you'll be escorted to a room. All of our patient rooms are private. Upon admission to your room, hospital staff will orient you. Please ask any questions as you think of them, and feel free to share any concerns you may have. You, your family, and Mercy Medical Center are all partners in your care. Each room is equipped with a whiteboard listing your room number, the direct phone number to your room, as well as the name of the nurse on duty.
At Mercy Medical Center, we understand the importance of good communication. That's why your bed remote is equipped with a call button. Please use this button anytime you need assistance from your nurse. Our staff will respond to call button requests as quickly as possible. Your nurse will also check on you as often as your care dictates. For instance, someone in intensive care may require more monitoring than a patient on the medical or surgical floors. We want to reduce your risk of falling while you are a patient at Mercy. Please use your call button if you need help getting up to use the bathroom, and one of our nursing staff will arrive at your room to assist you. Please ask us to explain anything you don't understand, including questions about the medications or treatments you are receiving during your stay.
We also utilize state-of-the-art Vocera wireless technology that allows our staff to instantly talk with each other regardless of where they are in the hospital. If it is an urgent situation and your nurse is not readily available, please feel free to contact another staff member or the charge nurse for assistance so that they can help you or locate your nurse.
We are committed to your safety and well-being. It is our protocol to wash our hands or use the alcohol gel each time we enter your room. If you don't see us using the foam or washing our hands, please feel free to ask if we have cleaned our hands. It is okay to remind us. Preventing infection is of the utmost importance at Mercy. Visitors are also strongly encouraged to wash their hands or use gel before and after seeing a patient. If you have an infection, for your protection, you, your visitors, and the staff may be asked to wear special protective clothing, such as gloves, gowns, and masks.
At Mercy, patient safety is always a concern, which is why we will ask you on several occasions to tell us your name and date of birth so that we can compare it with the medications and treatments we are providing. We haven't forgotten who you are. This is one of our patient safety procedures. If you are here for surgery, the physician or nursing staff will ask for your name and the type of surgery you are having, again, for your safety.
You will be asked on several occasions about your level of pain. If you're experiencing discomfort, please tell us right away so that we can help. Please don't wait or try to tough it out. While we may not be able to alleviate all of your pain, we will do our very best to help manage it. Having realistic expectations about pain control is important. Nothing will take all your pain away. However, in addition to medications, there are many other techniques that can help decrease your pain level, such as relaxation breathing, repositioning, positive affirmations, a heating pad or ice pack, gentle massage techniques, guided imagery, as well as listening to music.
If at any time you or family members notice a change in your condition, please notify your nurse immediately. Family members are more familiar with you and may notice changes more quickly. If you are at Mercy to receive orthopedic care, you will be asked to attend an education class prior to surgery so that you might better understand your procedure as well as rehabilitation and care afterwards. Our orthopedic unit is staffed by leading surgeons in this field, and our nurses and therapists are trained specifically to focus on your rehabilitation needs. Our pediatric unit has been designed to help our youngest patients and their parents feel safe and comfortable. We even have rooms equipped with PlayStation game systems. This unit features top pediatric physicians and is staffed by nurses trained with an emphasis on pediatric care. At nearly 12,000 square feet, our expanded emergency department is available around the clock to provide efficient, high-quality care for patients needing medical help in a hurry. The Mercy ER is a Level 3 trauma center with 26 beds and 1 dedicated trauma room. More than 4,400 ambulances arrive at our doors annually, and we treat several thousand patients each month. Our ER doctors are trained in emergency medicine, and all of our nurses are trauma certified. In addition, all ER team members are certified in advanced cardiac life support and pediatric advanced life support. A wide range of specialty physicians are on call and available if needed. The Mercy ER features the latest technology, including telemedicine, which allows ER doctors to consult with specialists at Oregon Health Science University Hospital in Portland, while allowing OHSU doctors to speak with and examine patients in the Mercy ER.
Your treatment in the emergency department begins with admitting and a rapid medical exam, or RME. During the RME, your condition will be assessed and you'll be taken to a private room where registration will be completed at bedside. X-rays, laboratory testing, and medications may be ordered prior to being seen by the emergency room physician. Flat screen TVs are provided in each room to increase your comfort while you're waiting for treatment. Depending on the severity of your injury or illness, you may be admitted to one of the other units within the hospital for additional treatment. There's also a possibility you could be taken to our intensive care unit.
A trip to the intensive care unit frequently comes as a surprise, not only to the patient, but oftentimes family members are cast into a hospital environment without any preparation or knowledge of what to expect. Our ICU is staffed by highly trained doctors and nurses, all looking out for the best interests of all patients in the unit. If you have any questions concerning the care of your loved one, please don't hesitate to ask. You are an essential part of their care.
Although it's important for you to be there for your family member, speaking to them and letting them know you are present, it is just as important that you take care of yourself. Even though you may feel the need to be in the room 24/7, it is easy to become exhausted and emotionally spent. Please take time to get rest and proper nutrition so that you can be at your best. We have social services staff available to help with important decisions regarding the care of your loved ones, as well as spiritual guidance to assist you through this difficult process. Due to the circumstances surrounding critical care, there may be times when visiting is limited. Our ICU lounge is available to family members to sit and gather your thoughts, plan what needs to happen after you leave the hospital, and simply take a break.
It can be a shock to see a loved one in a critical care situation with all types of medical technology in the room, wires and tubes connected to the patient. It is good to remember that all of these devices are there to help your loved one through their illness or accident recovery. These machines allow us to monitor vital signs, deliver pain medication, as well as nutrition, fluids, and oxygen. There are also a lot of different noises associated with this medical technology. An alarm doesn't necessarily mean that something is wrong. Many of the beeps and tones are reminders to the nurses caring for patients in the ICU. Even when there isn't a nurse in the room, the patient is always being monitored at workstations throughout the unit. In addition to the doctors and nurses in the ICU, there are a number of others on the medical staff, including physical, occupational, and speech therapists, helping patients take those first steps towards returning home and eventual independence, as well as respiratory therapists who work to prevent additional types of problems that can occur in this kind of environment, like pneumonia. Our goal is to provide you with 5-star care. We believe you'll find our staff to be caring and compassionate. We want to make you feel special during your stay at Mercy, so please tell us how we're doing or what we can improve to meet your needs. If you do have a concern, please tell us right away. Your complaints are important to us. It gives us the opportunity to respond and correct the problem. Part of that 5-star care is preparing for your discharge. We know the best place to heal is at home. That's why we begin planning your discharge when you're admitted, including patient education regarding care and medications once you return home. After you have been discharged, you may receive a phone call to complete a survey. We hope that your care at Mercy was the best possible and that you will feel good about sharing this information.
We hope that this presentation has given you valuable information regarding your stay at Mercy Medical Center. If you have any questions at all, please don't hesitate to ask a member of our staff, or feel free to contact us at 541-673-0611.